Hi everyone, let me greet first our lovely God. How great is the Lord God. Science says that universe is 93 billion light years in diameter or 886 trillion kilometers across. That's a number so huge. It's beyond our human capacity to understand. Yet, to the creator of the universe who is God, it's just a grain of sand. If the earth is just one grain of sand, how small is the man? Karunungan ni Solomon 11:23. Sa Diyos, ang buong daigdig ay isang butil lamang ng buhangin na di halos makatikwas ng timbangan. We're too small than God. How great is our God? If this is the earth, then how small is the man? Wisdom 11:22. In your sight, the whole world is a grain of sand, barely heavy enough to tip a pair of scales, a drop of dew on the ground in the morning. Too small the man. Limerence and the neurotransmitter biochemical brain cells. We knew only 4 known neurotransmitter hormone in our brain, but the truth, we have over 100 small molecules and neurotransmitter and neuropeptide in our brain. So let's talk about the 4 known happy hormone. Number 1 is dopamine. Dopamine, known as motivation and reward hormone. This hormone needs to balance. A low dopamine hormone symptoms are limb stiffness, cramps, and symptoms of Parkinson's disease. Then, for high dopamine symptoms, we have competitiveness, aggression or aggressive behavior, having poor impulse or lack of self-control. Then, how to balance our dopamine naturally. Number 1, consume foods high in tyrosine, diet in high protein and low carbohydrates, physical exercise habit, then get adequate sleep, then listening to calming music, then go outside. Then we have number 2, serotonin, known as the supports feelings and happiness hormone. Low serotonin symptoms, feeling of low, depression, sleeping problems like insomnia and disturbed sleep, anxiety, and increased sexual desire, prone to fantasizing. The reason why limerence were connected to these neurotransmitter imbalances because of the surge of dopamine hormone, which are competitiveness, aggressive behavior, and lack of self-control, and the need of reciprocation because this is a reward hormone, plus the low level of serotonin, the feeling of low, depression, anxiety, and sexual fantasies. There are lots of antidepressants medication for this problem. Class of drugs called SSRIs or selective serotonin reuptake inhibitors. There are mild side effects. The long-term use of sertraline can cause sexual dysfunction, memory loss, and cognitive impairment or kapansanan sa pag-iisip. That's why I recommend auricular acupuncture because it's direct treatment and no side effects. Number 3 is the oxytocin, known as the love hormone or bonding hormone. Low oxytocin symptoms, depressive symptoms, growth hormone syndrome, and the rare case, the non-functioning pituitary gland. I have 2 patients having this rare case of non-functioning pituitary gland or oxytocin drop. I will tell you later. Then, high oxytocin level symptoms are seizures, difficulty breathing, severe headache, pelvic abdominal pain, rashes and itching, and vaginal bleeding. So, how to balance oxytocin level? Is just a simple touch from loved ones and simple back rub. Simpleng haplos sa likod. 4. We have endorphins, known as feeling positive hormone, positive feeling and pleasure, happiness and love hormone. Then low endorphin symptoms, depression, chronic pain in the body, addiction, impulsive actions, sleep issues, and anxiety. How naturally boost endorphins? 1. Surely get acupuncture for boosting endorphins. Exercise, listen to music, laugh. Laughter is the best medicine. Watching super laugh. Dance, meditation, eat dark chocolate, and have clean sex. If you don't have sex partner, undergo acupuncture treatment. Take endorphin mood stabilizer, but be careful for the side effect in long-term use. I will tell you about my patient. Her oxytocin dropped. She's 30 years old and outstanding manager of a known graduated cum laude. She underwent cholecystectomy. It was a successful operation, but they noticed she has some kind of amnesia. They made a lot of tests, medical tests. Maybe it's from anesthesia overdose or caused by infections or or deficiency in vitamins, hormonal problem, metabolic imbalances, or damage of brain neurons, or medication side effect. Then they made a neurotransmitter test through saliva, blood, and urine. They find out that the pituitary gland not functioning, the neurotransmitter oxytocin drop, the reason of her cognitive impairment. She has this identity confusion, feeling angry without reason, impaired judgment, difficulty understanding situations, then memory loss, frequently asking the same question, repeating the same story over and over, not recognizing familiar people and places. In short, she has a 5-year-old mind. The sad thing, she can't go back to her job anymore. Her mother brought her to her office to keep all her things. She recognized some of her belongings but no longer do her job. She forgot everything and she cannot recognize her office mates. That's why they came to me and we had this combined treatment, acupuncture, therapy, physical therapy, and continue her doctor's prescribed medication. And now she's improving. Her case is very rare, but the reason of it is the not functioning the pituitary gland that drops the oxytocin level. Maybe we will not be affected by nature calamities, but there's possible natural disaster inside our brain, our neurotransmitter function that affects our thinking and our behavior. We should not be so much proud of what we have, what we achieve, because these things too little in the sight of God. So love and forgive people, because love and forgiveness is the nature of God. Do not revenge, because rotten fruits fall in its own. Like human, we fall through our inner disaster, the imbalances of all biochemical inside us that made us fall. Please like and subscribe my YouTube channel. Thank you and God bless.